Alright, so what's the first thing that comes to mind when you hear POTS? Some of you are probably thinking maybe planting some flowers with your grandma, making some mac and cheese for lunch. For me, it's postural orthostatic tachycardia syndrome. When I was younger and in gymnastics, I quickly realized that I can't keep up with the other girls in my class or catch my breath as quickly as they can. Years and years later, I was officially diagnosed with POTS, which is, again, postural orthostatic tachycardia syndrome. Throughout this speech, I will hopefully inform you of what it is, how to treat it, and some of the symptoms that come along with it. I know that some of you are thinking about going into the medical field, so you'll be around chronic illness a lot, and some of you who are thinking, I don't even want to go near the medical field, you will be interacting with people. And 40% of Americans have some form of chronic illness, therefore you will be involved with this somehow. So POTS, it is a more specific term of dysautonomia, and three key words that you need to remember with what it is that it's an invisible illness, which means that on the outside you don't look sick or sometimes act sick, but you are. It is a chronic illness, which means it is long-lasting, and it is an autonomic dysfunction, which means my autonomic nervous system doesn't work. And in plain English, my involuntary function, so anything you don't consciously control doesn't work like it's supposed to. There are some regulations, if you so to speak, for being professionally diagnosed with it. Your orthostatic blood pressure will drop, which means anytime you change position, so sitting to standing or laying to standing, it'll drop, and simultaneously your heart rate will increase. In order for it to be considered POTS, within a few minutes your heart rate will increase 30 beats per minute, or over a span of 10 minutes it'll get up to 120 or more. And this diagram kind of shows what happens when you do change positions. Because your blood pressure drops, the blood isn't getting to your brain like it's supposed to, so most people experience lightheadedness or even passing out. There are a lot of other symptoms besides lightheadedness. There is a huge list. This is a brief list. You can either have all of these at once, you can have a few of them. Sometimes you wake up and have none, and then a few hours later you're passing out in SPS, and Coach Harlan is freaking out. The most common ones, though, are like blurred vision, brain fog, dizziness, chest pains are all very, very common. Because there are so many symptoms, it is extremely hard to diagnose. So just personally, I have 9 different doctors on my team, so to speak. I've been diagnosed with anxiety, COPD, chronic heart failure, anemia, all the above, which all came back that it wasn't what I had because I only had 1 or 2 of those symptoms. Because they don't know what specifically causes it, because each case is so completely different, that it can't be cured, but it can be managed. There are some medications that are very common. So salt tablets, which are exactly what they sound like. It is 2 tablespoons of salt compacted into a tablet about this big. Do not recommend, they're very gross. Fluorocortisone controls your kidney function, so it keeps your water and salt in your body instead of filtering it out like it's supposed to. Myodrin helps the brain activity part of this, which helps with your migraines and your dizziness and helps try to regulate some of that stuff. Beta blockers affect your heart and keep them pumping like they're supposed to. A lot of people don't like taking medications because they either don't help at all, they make their symptoms worse, or it's just not worth it because they're only controlling one of that huge list of symptoms. So a lot of people choose to just manage it, and a few ways to do that is drinking a lot of water, and by a lot I mean a lot. 200 ounces is the minimum recommendation. When they told me to start out by drinking 10 of these little plastic water bottles, which would only be equivalent to 160 ounces. I'm supposed to drink 200 to 300 ounces of water. increase your salt intake so you don't have to take those salt tablets. No caffeine or alcohol, because caffeine will raise your heart rate and then confuse your body even more, and alcohol does the opposite. It'll slow it down and confuse it. Watch your dairy and gluten intake, because both of those are inflammatory, which is hard for your body to digest, and which is one of your involuntary functions. And lower carbs for the same reason, and lean proteins are also easier to digest. And they also recommend exercising a lot, which is kind of confusing because that's a trigger for most people, but you have to stay active. Other aids that I guess you are qualified to have would be service animals. So to do things like do your laundry or get you water, or when you do pass out or have your seizure, they will get somebody to help you. You can also have handicap parking because it is a disability. According to Dysautonomia International, 25% of POTS patients are unable to work because of this disability, and other medical things like wheelchairs and stuff like that. Today I have provided you with information of what POTS is, what it looks like, and some treatments that can help you when dealing with this. If you do find yourself around somebody who has a chronic illness, or more specifically POTS, I hope that you understand that sometimes you can't always see what's going on, and that now you will know better what to do. As I stated in my intro, some of you plan on going into the medical field in some way, or even if you don't, statistically you will meet or run into or be around a chronic illness. And I hope with this you have a better understanding.